Today we are going to discuss about one of the important endocrine gland, which is when you practice most of the patients in order to investigate the thyroid gland. So hormones which are secreted by the thyroid are very important, and clinically you can many diseases you are going to diagnose on the basis of the investigation of the thyroid hormone. So this thyroid gland is one of the endocrine gland, which is situated in the lower part of the front end side of the neck region. So thyroid, this word is derived from the Latin, that is a thyroid, means that is a shield like. It appears like a shield. Okay. So whatever this name is given to the thyroid gland. So thyroid introduction, we are going to study thyroid under the headings like introduction. Then we are going to study about what are the features it is having. Then what are the situation of the thyroid gland. Then what is the dimensions and what are the parts. Then what are the external features like it is having the thyroid. In this diagram you can see this is a hyoid bone and this is thyroid cartilage, and we have this is a trachea. So upper part of the trachea, this thyroid gland is clasped, that is clasping the upper end of the trachea. Clasping means holding the upper end of the trachea. So that is the one which is you have to remember. So in the introduction you have to tell first one, thyroid is a name derived from the shield like. That is a word which is how it appears like. You can see this is a shield like appearance which you can get, and this is thyroid, which is an important gland, one of the endocrine important gland. Where it is situated? It is situated in the lower part of the front end side of the neck region. So lower part of the front end side and neck region it is situated. That is the most important, where it is located. Then this thyroid gland is the most important gland, which is because many hormones secreted. So these hormones will be maintaining the first one, basal metabolic rate. All functions of the thyroid, which is you have to remember, it regulates the basal metabolic rate, and it also plays an important role in the psychic and somatic growth. Psychic means you have the your brain and intelligence all related to the this will be, that is we call as a psychic. And we have the somatic means body development. Soma means body, so body development which is relates to the all, means plays an important role in the psychic and somatic important, that is the development, and plays an important role in the regulation of the basal metabolic rate. And third function, it also regulates the regulation of the calcium metabolism. Basal metabolic rate, psychic and somatic growth, and calcium metabolism. So these are the three important functions done by the thyroid hormone. So that is the one which is you have to remember. So after this, when you see the thyroid, when you see the structure of the thyroid in the neck region, it is a bilobe structure, which is appears like a two lobes, right lobe and left lobe, which are connected by the isthmus. One middle part which is connecting, that we call as an isthmus. But actually it is appears like a H shape. You can see capital H alphabet, that is we are going to get, that is you have to remember. So in this you have to remember the external features of the gland are the first one you have to remember. It is a bilobe structure, H shape. Then it is having the right lobe, left lobe, and this is connected by the right and left lobe by we have the isthmus. Okay. So two lobes connected by the isthmus. Next you have the one part which is you have to remember in this. When you see this part, this is one hyoid bone, the fibrous band. Sometimes we are going to get some fibrous bands which are arising from the hyoid bone, and they either attach to the one of the lobe of the gland. So that we call as a levator glandule thyroid. These fibers which are attached fibromuscular band which are attached from the hyoid bone, and they are either to attachment to the one of the lobe of the gland, that is we call as a levator glandule thyroid. And one separate, maybe sometime we may have the separate lobe, and that lobe we may have the pyramidal lobe. So this may be the pyramidal lobe. Fibrous band may attach to the levator glandule thyroid, attached to the pyramidal lobe or either one of the lobe of the thyroid gland. So this is the one which is, you have to remember about the external features of the thyroid gland. I have told it is a H-shape alphabet English. That is the one which is, you can see here, and right and left lobe connected isthmus. There may be the pyramidal lobe, one attached, that is the one which may arise from the thyroid tissue. Then there is a fibromuscular band running downwards from the hyoid bone to the one pyramidal lobe or either any lobe. So this is all about the external features of the thyroid. Then what is the location and situation of the thyroid? I have already told this thyroid is situated front and side of the lower part of the neck region. So exactly where it is located, you have to remember this is exactly related to the attached to the C5, C6, C7 and T1. Opposite the cervical vertebrae, now I am talking about the location and situation of the thyroid gland. Where exactly situated? I have told first word, it is situated lower part of the neck region, that is the front and side of the lower part of the neck region. One. Second, exactly where this thyroid, when you see, this thyroid will be against the vertebrae C5 you get, and C6, C7 and T1. Up to the T1 it is situated. So that is a gland exactly situated in the neck region. Then when you see the this thyroid isthmus which is there, you are going to get, that is the one which is related to the tracheal rings, posteriorly relating to the tracheal rings. We have the here third and fourth tracheal rings, and which is relates to the total. So almost all we are going to get the, and this thyroid gland is attached to the middle of the, this is one which is a green which is here represented with the thyroid cartilage, and this is a hyoid bone. This is a hyoid bone. Immediately below we have the thyroid cartilage. Below there is a thyroid gland. This thyroid gland which is attached to the middle of the thyroid cartilage. This is the middle of the thyroid cartilage, apex of the one lobe is attached, and here extending to the we get the fourth or fifth tracheal ring, till the fourth or fifth tracheal, and here second and third level tracheal ring, the isthmus is situated. So exact location in the all aspect I have told. In generally you are tell front and side of the lower part of the neck region located. Second one, it is against the cervical vertebrae C5, C6, C7 and T1. Then I have told that they extend from the middle of the thyroid cartilage to the fourth or fifth tracheal ring, and the isthmus line second or third tracheal ring which is there, that is you have to remember. And it is clasping the upper part of the trachea. Clasping means holding, that is your. So this is all about the location and situation of the thyroid gland. Next, going to the other part, when we see the this thyroid, totally thyroid is of appears like our distal phalanx. Whatever distal phalanx of thumb is there, that much is your thyroid. Usually we say that about. Okay, so this tissue, when you see in this diagram, you have come across the one which is this appears like in this way. Okay, then next, what is the measurements of the, this thyroid is having two lobes, right and left lobe and isthmus. We should have the measurements of the lobes, and then isthmus. This lobe is measuring about 5 centimeter into 2.5 centimeter into 2.5 centimeter. Length, width and breadth of the thyroid gland. Each lobe of the thyroid is measures about the 5 centimeter length. We have the 2.5 centimeter width and breadth thickness. We are going to have 2.5 centimeter. Means you have to tell centimeter into 2.5 centimeter into 2.5 centimeter. That is about the each lobe of the thyroid. Isthmus, it measures about the 1.2 centimeter into 1.2 centimeter. 1.2 centimeter into 1.2 centimeter into length and width will be the thickness will be the 1.2 centimeter. That is about the thickness of the isthmus, measurements of the isthmus. Next, which is you have to remember, what is the weight of the thyroid? It is a 25 grams. Very important. Weight of the thyroid gland can be asked in the MCQ. You should able to write about that is what is the weight of the thyroid gland. It is a 25 grams, not milligram. Parathyroid comes in milligrams, but here you have to remember the thyroid is of the 25 grams. Okay. When you see this one, thyroid, it is a tissue which is we are going to get the actual thyroid gland. Then we are going to have it is made up of. Then we are now dealing about the structure of the thyroid. What structure actually it is made up of? It is made up of the true capsule, false capsule, then actual gland. It is tissue we are going to get. Three components which are there in the thyroid totally. One is which is a false capsule, which we call green, which is surrounded. When we take the section of the thyroid, which is covers around the most outermost, is by the false capsule. Then second one, which is we have the true capsule, and these are the one plane which is we are going to get in between the true and false capsule, and these are the venous plexus. So this is the venous plexus which are there. They are situated deeper to the true capsule. So that when we remove the thyroid, surgically removal of thyroid we do, that is we are doing the thyroidectomy, we are going to remove the thyroid with the true capsule. Because these venous plexus are present below the true capsule, and if they are left behind, they cause the hemorrhage. Bleeding can occur, then may cause a patient may to go into a shock. Then you cannot stop the bleeding. After the surgery, even though surgery is successful, but there is a chances of bleeding if these venous plexus remains behind. So here you have to remember, this tissue is same as that of the like one gland which is in the males we get, that is a prostate gland. It is only present in male, that is the prostate gland. Near and around the neck of the urinary bladder it is situated. That structure and thyroid, we may have the comparison like that of the true and false capsule. So in that prostate, we have the venous plexus are present in between the true and false capsule. Very important this you have to remember. These venous plexus, when we do the prostatectomy, surgical removal of prostate, when we do the surgery of the thyroidectomy, surgical removal of thyroid gland, this structure is very important to understand because they may lead into a hemorrhage. Bleeding can occur. If surgery is done, it proceeds into the bleeding. So hemorrhage we call. So that is prevented if we do the proper one. If you know the anatomy, structural anatomy of the thyroid and prostate. So what I am talking here, in the thyroid gland, you have to understand first thyroid, then compare with the prostate gland. So what I am talking, this venous plexus of the gland, these are situated deep to the true capsule. You have the false capsule first, second we have the true capsule, deeper to that we have the that is the venous plexus, and this is a thyroid gland tissue. So we want to remove the thyroid gland. That time we are going to remove with the true capsule and thyroid gland is removed. There is no chance of bleeding occurs. Okay, but in prostate, it is these all venous plexus are present in between the true and false capsule. That time what we do? We are not going to remove the true and false capsule, only we remove the prostate tissue. Prostate gland only we are going to remove. Because of that, we are not going to disturb the true and false capsule because in between we are going to have the venous plexus. So in the prostate, we are going to leave the true and false capsule because venous plexus are present in between the two layers. Then in the thyroid, we are going to remove the thyroid gland. With the venous plexus, we are going to remove thyroid tissue, that is in the thyroidectomy. So this is all about the, you have to remember about that is the structure of the thyroid in comparison with the prostate. They are same gland, true capsule, false capsule. Location of the venous plexus below the true capsule in the thyroid, in between the true and false capsule in the prostate. So we are going to proceed the surgery relating the thyroid and prostate. One should we keep under in our mind, that is these venous plexus causing the bleeding or after post-operative hemorrhage. So if they are left behind in the thyroid, because of that we are going to remove the true capsule. But in the prostate we are going to leave behind because they are present in between the true and false capsule. Only prostate gland is removed. So this is the one which is when you attend the thyroid and prostate surgery in third year. When you go to the third year, you go for the OT, operation theatre. That time if you attend these two, this is a sure question will be asked by the surgeon. So this is the one which is anatomy knowledge you should have in your mind. Okay. So this is the one which is you are going to get it. So next, when you see the location, extended neck, both the sternocleidomastoid, right and left sternocleidomastoid, behind these are this is one trachea and tracheal ring, and actually on the front view thyroid gland is seen this way. So that is the one which is you have to remember. So each on the lateral view of the thyroid, you are going to see in this way. So this is a one lobe which is we call right or left lobe, that is having the base and apex, and we are going to have the anterior border, medial and posterior. That is anterior and posterior border. We have the three surfaces. Each lobe is having the base and apex. Here also you can have the in the thyroid. Here we have the base, each lobe having the external features. I am talking general features of thyroid gland. Each lobe is having the base and apex. It has an anterior border and posterior border, two border. Then it has the one which is we are going to get the medial surface, lateral surface and anterior. So we are going to have the three surfaces, anterior, medial and posterior surfaces. Two border, anterior border and posterior border. Then when you go to the isthmus has two surfaces and two borders. It has an anterior surface and posterior surface, upper border and lower border. That is the one which is you have to remember in the thyroid. So this is all about the first basic thing which is you have to know. This one simple diagram you have to remember about the vertebrae and all. And in this on the extended neck region, what are the parts which are seen? Hyoid bone. In your body also you can test this hyoid bone. Below that is a thyroid cartilage. Then below that thyroid gland. Then it is a clasping the upper part of the trachea. This basic thing you have to know, and the trachea is having the tracheal ring on anterior aspect. Posteriorly it is made up of the muscle, trachealis muscle. So that is the one which is you have to remember. And levels of cervical vertebrae, here you get the cervical vertebrae level C5 to the T1 vertebrae. That is the extension of lower part of the lobe. And what is levator glandulae thyroidae? Question is asked, what is the levator glandulae thyroidae? There may be some fibers, fibromuscular bands arising from the hyoid bone. They may attach either to any lobe of the thyroid or any one of that is a pyramidal lobe. And these fibers we call the levator glandulae thyroidae. So this you have to remember tracheal rings which are there. Second and third tracheal rings you are going to get at the level isthmus, and fourth or fifth tracheal ring is we have the lobe of that is a thyroid. Here fourth tracheal ring. So this is very important. Tracheal rings we are going to get about the counting from first to the last till the bronchus division by the trachea. So next, which is you have to understand how the actual thyroid tissue is represented, how it appears. You are going to get, and this is the one which is we are going to deal about the blood supply of the thyroid. Thyroid structure of the thyroid is very important in comparison with the prostate gland, because it has both the gland, thyroid also, prostate also gland. Prostate is only found in the males and near the, that is the neck of the urinary bladder of the males. So that tissue is comparison to the thyroid is same, because it is a gland is there here, thyroid, prostate also gland. It is also made up of true and false capsule, true and false capsule. Only the presence of the venous plexus in the thyroid is deeper to the true capsule. In the prostate, we have in between the true and false capsule, false and true capsule in between. So during thyroidectomy, thyroid is removed with the true capsule to prevent the hemorrhage, and in the prostatectomy, we are going to keep the true and false capsule behind to prevent only glandular part of the prostate is removed. This is one structure you have to remember. Next, you have to remember about the external features. As I have told, each lobe of the thyroid having the base and apex, and it is having the anterior border and posterior border. And we have medial, lateral and anterior surface. So anterior we have here anteriorly, then posterior medial and posterior lateral we may call our medial lateral surface and anterior surface. Two border, anterior, posterior, apex and base. Isthmus, as I have told, isthmus which is I have told about it has two borders and two surfaces. Here upper border, lower border, anterior surface and posterior surface. This is all about the important first part of the thyroid, which is we have covered. Introduction. Why thyroid is like named as a thyroid, because according to its appearance sealed like, that is I have told. External features of the thyroid I have told. Situation or location of the thyroid. Then we have told the measurements of the thyroid, weight of the thyroid, structure of the thyroid gland, and what are the external features of the each lobe of the thyroid we have told. This is the important part of the first part of the thyroid gland. So also I have told the measurement here. Each lobe measurement is 5 into 2.5 into 2.5. As you expect your thyroid gland that of your distal phalanges of the thumb, that much will be the your thyroid gland in your lobe. And what is the measurement of the isthmus? Isthmus is measuring 1.2 centimeter into 1.2 centimeter, and 25 gram will be the weight of the thyroid. That is the total about the first part of the thyroid we have completed here. Okay, so most important you have to concentrate in the introduction. As I have told, it is plays an important role in the basal metabolic rate, plays an important role in that is psychic and somatic growth. Psychic and somatic growth. When patient came to you, that is I am forgetful, weak memory, brain is not developed, or some childs are having the mental retardation and all, that time you have to assess the investigation relating to the thyroid. Then next you have to tell it plays an important role in the calcium metabolism. So any person comes to you, reaches investigation, what when you suppose hypocalcemia, hypercalcemia. So that time you have to investigate. Any child is brought by the relative which is mentally retarded, or any which is complaints relating. So next we may have the basal metabolic rate. These three are very important. All females we have to assess after the 30 to 40 years of age. Any related obesity is there, more increase in the weight or less weight is there. Both are related to the thyroid disorder. Increasing also obesity, and if you are becoming less putting weight is very less, that time also you have to assess the thyroid, because both are related to the thyroid. So females you have to assess the thyroid, T3, T4 and TSH. that is the one which is you have to hormone secreted by the thyroid we are going to deal. So clinically very important and very anatomically it is asked question very important. That is the one which is you can remember. So most important gland which is relating to the endocrine system, pituitary is master, but all relates to the all thyroid. Most of the metabolism, calcium and basal metabolic rate, all is maintained by the hormones of the thyroid. So this is all about the thyroid first part. Next part which is we are going to be right, that is deals, that is the relations. What is the blood supply, venous drainage, what is the structure histologically, how the structure and clinical anatomy of the thyroid, which is we are going to deal in the next lecture. So these all are the, which is the first part of the thyroid gland. Okay, write down.